everyone, it's Sarah with registerednursern.com, and in this video I'm going to be doing an NCLEX review over urinary tract infection. And this video is part of an NCLEX review series over the renal system. And don't forget the free quiz that you can access at the end of this video. So let's get started. So what is a urinary tract infection? It is an infection found within the urinary system. So what structures are included in the urinary system? Well, we have two kidneys. We have a right kidney and a left kidney. And coming out of the kidneys, which help drain the urine, are your ureters. And the ureters attach to the bladder, and then the urine comes out of the urethra. Now, you can have a urinary tract infection in the lower part or the upper part or both. And typically what happens is that a UTI tends to start in the lower part of the system and can migrate its way upward. So with the lower, you can have an infection of just the urethra, which would be considered urethritis, or the bladder, called cystitis. Now with the upper system, the ureters can be infected, and typically if they're infected, you probably either have a lower urinary tract infection or an upper or both, and it's called urethritis. Then you can also have where the kidneys are infected, and it's referred to as pyelonephritis. And if the kidneys get infected, this is not good because the kidneys, if you look here, they are connected to our circulation. So if they get infected, that infection, whatever's present, can easily migrate into that circulation, go to the heart, and then we can get septic shock and the patient can die. So we really got to be careful and assess appropriately to make sure it's not spread to the kidneys. Now, urinary tract infections tend to affect women more than men. Why? Well, really the reason why is the female anatomy. In a woman, the urethra tends to be shorter than the male's urethra. So it makes it easier for bacteria to migrate up through that urethra and make its way to the bladder. Another thing is the close proximity between the rectum and the urethra, making it easier for bacteria just to migrate over there, especially if the woman is not wiping properly, like from front to back. Instead they're wiping back to front, or wearing tight underwear, things like that. Just make it easier for specifically E. coli to travel to that urethra and infect the woman with a urinary tract infection. Now let's look at how urine flows and the defense system set in place in your urinary tract that really helps prevent urinary tract infections. Because here in a second when we go over the causes, it will make more sense in why that specific cause is causing the patient's increased risk of a UTI, because you're seeing a breakdown in these defense systems. So first, how does urine normally flow? Okay, we know that the kidneys filter our blood, and the nephron plays a huge role in this, and it creates a substance called filtrate, which will leave the nephron as urine. So urine will be produced and it will leave at the renal papilla from that nephron. It will go down through the minor and major calyx, out through the renal pelvis, down through the ureters, and your ureters connect to your bladder. And what's neat about the ureters is that you have these one-way valves that prevent urine from in the bladder from backflowing into those ureters, because we don't want that to happen, because if that happens we have a higher risk of urinary tract infection. That urine in a sense is staying stagnant, and that's a good medium for bacteria growth. And those one-way valves are called uretrovesical valves, and then the urine sets into the bladder, which it's stored, and once your bladder becomes really full, you'll feel that urge to void, and you will void down through the urethra and it exits there. Now let's look at our defense system. Okay, the first defense system is really the physiology of how the urine drains out of the kidneys, because it drains in a downward motion. It doesn't backflow, because if we have backflow of urine, we have beautiful conditions for a urinary tract infection. So what structures really help us keep that urine flowing downward? Because if they get messed up, then we're going to have that increased risk of urine backflowing. So the first thing, which we sort of talked about, are those uretrovesical valves. And in one condition that we're going to talk about, these valves are messed up. They're causing reflux of urine to go backflow into the ureters into the kidneys. So some conditions can cause issues with those valves. Another thing are the muscles of the bladder. Your bladder helps squeeze out that urine completely. We don't want to have urinary retention, which is one of the reasons a person can get urinary tract infection. However, over time, like with patients who have diabetes or patients who are immobile, who aren't able to get up and go to the bathroom, so they have a distended bladder, over time those muscles become weak, which can lead to the bladder muscles not working properly. Another thing that helps keep that urine flowing downward is the pressure created by the urine in the bladder. All that urine in there creates pressure, which in a sense sucks that urine down through the system with the pressure through the ureters and helps the person get rid of the urine. Now, another defense system is really the urine itself. Urine typically is sterile, and it has these antiseptic properties to it that helps prevent germs from sticking to the lining, like the lining of the bladder wall. And what plays a role in that is the pH of the urine. We like acidic urine and the urea concentration. However, with some conditions like diabetes, we can have issues where the urine has changed, because remember, with diabetes, one of the reasons we can find out a person has diabetes is when we check their urine, they're leaking glucose in their urine. And normally in the nephron, specifically the proximal convoluted tubule, 100% of the glucose is normally reabsorbed. However, with diabetes, glucose, there's too much, and so it's leaking into that urine. And that provides a beautiful medium for bacteria to grow and for them to just flourish, where normally if they had a better pH, they wouldn't have that. Now also, your bladder, the lining within the bladder has your immune system cells, which help fight bacteria. So if bacteria do tend to get in there, the immune system will see that and attack that. However, whenever you have a person who has a suppressed immune system, they are at risk for having bacteria to continue to grow, because that immune system is not attacking that germ. Now, another defense system, this is specifically in males, is the prostate gland. The prostate gland secretes this fluid that has antimicrobial properties to it, and it helps coat the urethra. So if bacteria gets in there, that fluid from the prostate gland is in there, it can help kill that bacteria. However, whenever you have an enlarged prostate, it is not secreting fluid properly, and it's squeezing that urethra shut, so you're going to have backflow of urine, and you're not going to have that antimicrobial fluid to help ward off that infection. In a defense system, specifically in women, is the normal flora found in the vagina. Now, this is really due to a bacteria called lactobacillus, and it helps keep the environment acidic, because the vagina and the urethra are close together. And whenever that lactobacillus is there, if by chance from the rectum E.coli did migrate upward, that lactobacillus can help fight that infection due to the acidic condition, because the bacteria will not live. So that is another defense system that the body has. Now let's look at the causes of urinary tract infection. Most common type of urinary tract infection tends to be bacterial, and the most common bacteria tends to be E. coli, which has probably came from the GI system. So for testing purposes, I would try to remember these causes, because test questions like to ask you, out of all the patients, which patient is most at risk for a urinary tract infection? Okay, so to help us remember, let's remember the mnemonic hard to void, because with UTIs, they have difficulty peeing. Okay, the first one is H for hormone changes. This can be with pregnancy, menopause, birth control. Why? What does this do? It changes that normal flora in the body. And what can happen, remember whenever we were talking about one of those defense systems, is that lactobacillus. And whenever you throw off the hormones, that flora changes down there, and bacteria can get in there and cause an infection. So anytime you're messing with hormones, you're at risk. Another one is A, antibiotics. Again, this just changes that normal flora, kills all the good bacteria. R for renal stones. What happens is that those renal stones get in there and they prevent that urine from draining. And what can happen is that a stone can form, and it can form within the kidney, and you can have it maybe in the calyx of the kidney or stuck in the pelvis of the kidney or the upper part of the ureter. And what happens is that that urine will not drain out of that kidney, and it'll stay stagnant in there, and this can lead to a urinary tract infection. D for diabetes. With diabetics, they tend to have compromised circulation. They have decreased immune system response, so bacteria gets in there, they don't attack it as efficiently as they should. They tend to have, if it's not controlled diabetes, they can have glucose in their urine, which is a great environment for bacteria to grow. And they tend to have that urinary retention because the nerves aren't working properly to let them know, hey, I need to empty my bladder. Those muscles become weak due to that overextended bladder over time, so they are at risk for diabetes. Another thing are toiletries, T for toiletries. This is because toiletries like taking excessive bubble baths, using that soap over time, it's coming in contact with the urethra, can cause irritation. Also powders, perfumes, tampons, scented or not scented, and especially scented sanitary pads. So if a woman during menstruation, if she's having a lot of recurrent UTIs, you need to let her know not to use scented tampons or sanitary pads, and to avoid tampons because that can cause urinary tract infection, increase her risk. Okay, O for obstructive prostatic hypertrophy, and this is seen in males, typically who have BPH, and what happens with this is that they get urinary retention. And what happens is that prostate enlarges and it squeezes or compresses the urethra. Urine can't get out, so you get urinary retention. And also that prostate gland isn't able to secrete that antimicrobial fluid properly. So you lose the fighting power of that fluid to fight off infection as well. Next, vesicoureteral reflux, also called VUR. This tends to happen in the pediatric population. It's a congenital defect, and what's happening is that urine is backflowing from that bladder to the kidneys because of a valve defect. Remember, we have those one-way valves called ureterovesicular valves, and they are not closing properly, and they are allowing urine to backflow up to through those ureters and into the kidneys, and these kids will have reoccurrent constant infections, and when they go in, they look and they see that they have issues with their valves. Next, O for overextended bladder, and this is where the bladder is not emptied whenever it needs to be emptied. Patients who are at risk for this are patients who are immobile, they can't get up, they can't move, so they just sat there with a overextended bladder. This weakens those bladder muscles, which will lead to urinary retention, so whenever they do go to void, they keep some of that urine in there. Another person at risk for that are nurses, because we tend not to go to the bathroom when we need to because we're going to get this done, we're going to get that done, and we tend to, some nurses struggle with overextended bladder, so always empty your bladder. Next, I, and we have several of those. The first I is indwelling catheter, like a Foley catheter, and if you've ever worked in a hospital for any time, you're always hearing, get that Foley catheter out, because that is just an entrance way for bacteria to get in and cause a urinary tract infection. So we want to remove those Foleys as soon as possible. The other I, invasive procedures, intercourse, sexual intercourse, and especially if spermicides are used. And women are definitely at risk for this just because of that short urethra, so voiding after sex is very important. Another thing is our D for decreased immune system. That immune system just isn't able to fight off infection, and they are really at risk for developing your viral and your fungal origins of the urinary tract infection. Now let's look at how a urinary tract infection is diagnosed, because as a nurse you need to be familiar with tests the physician may order, because you're going to be playing a role in collecting some of these specimens. Okay, so the biggest thing that's ordered to help diagnose a UTI is a urinalysis, also called a UA, and it's going to check for white blood cells and bacteria. And your role as the nurse is to collect this via the clean catch method. So you're going to either be doing this or the patient, so you'll want to educate them how to do this. And this method helps us prevent contaminating that specimen, which could give us a false positive. Okay, so when you're collecting a UA, it's best to collect when the bladder has been full for about 2 to 3 hours, so the urine is concentrated, not diluted. And what the patient will do, or you'll do, is that you will wipe with an antiseptic wipe. So you will clean the area. Then you will have the patient void a small amount in the toilet. And then they will stop, and then midstream, they're going to void until it's halfway full in that cup. And they'll want to hold the cup at least a few inches away from the urethra so it doesn't get contaminated. Now, sometimes patients have Foley catheters. So how would you collect a urinalysis from a Foley? Well, on the Foley, close to where the Foley is inserted, just a little bit down the tubing, is an access port. And this port, you can clean the port with an antiseptic cleanser, then use a needleless syringe, and it'll just screw on the access port, and you can withdraw some urine that you need and put it in the cup. Sometimes there's not urine freely draining from there, so you can clamp the tubing to collect some of the urine. However, you never ever want to collect the specimen from the collection bag, because sometimes there's bacteria present in there, and it's not a good indicator if the patient has a urinary tract infection. So always use the access port. Another test ordered is called a urine culture. Sometimes, a lot of times, a UA and a urine culture will be ordered together, and this will assess the type of bacteria, if it's caused by bacteria, that is growing in the urine, so they can order antibiotics appropriately to treat that specific bacteria. However, it depends on your lab, but it takes about 2 days to receive that result back. Now, typical question that likes to pop up a lot is the following. Patient is ordered to start IV antibiotic therapy or PO antibiotic therapy who has a UTI, and the physician has also ordered a urine culture. How will you proceed with following out these orders? So you want to remember, you want to collect your urine culture first before you even give that antibiotic, because giving that antibiotic, if you gave that antibiotic first, it would start fighting the infection, and you wouldn't be able to properly culture that urine. So always do the urine culture first, then give the antibiotic. Okay, another test is called a cystoscopy, and that's where they insert a scope and they go down and they look inside the bladder and the urethra. And this is ordered most commonly for people who have those recurrent urinary tract infections. They want to see what's going on. Is there a structure issue in there, a blockage, something like that? Okay, now let's look at our signs and symptoms of a UTI. What is a patient going to report to you? Okay, patient may have pain when voiding. It can be described as like a burning sensation whenever the stream starts when they're voiding. They may also have a persistent need to void, like just this really intense urge. They've got to go pee. But whenever they do pee, it's just really small amounts, or there's nothing that comes out at all. And that's because that bladder is irritated and that urethra, it's really inflamed. The urine will be odorous. This is definitely something that you will be able to smell, and you will know it's there. It's not just a faint smell, it's right in your face there. The urine will appear dark and cloudy. It won't be that nice, light yellow color. Also, during your assessment, they will have pain with what's called the costovertebral angle, and this is known as CVA tenderness, and this is most commonly associated with a kidney infection, and this is how you would assess for CVA tenderness. So what you will do is that you will find where the last rib on the back is, which is your 12th rib, and you will find the spine, and you're going to go at the angle, and the angle is below the 12th rib and in between the spine, and this is about where your left kidney is located and about where your right kidney is located. So then you're going to take your hand, you're just going to place it over there, and you're going to thump the area with your fist. You're going to make this fist, and then you're just going to thump it. And we're wondering if the patient has pain whenever we do this. They'll have pressure, but pain is what we're looking for. So like that, and then go to the other side and test it. And if they have pain, that could indicate, again, a kidney infection. Another thing your patient can report are spasms or like cramping-like feeling of the bladder and the urethra, and this can be very, very painful to a patient who has a UTI. Also, they will have a fever, and on that urinalysis, they can have increased white blood cells. Now, one thing I really want to point out, because this is another thing that tests love to ask about urinary tract infection. Okay, in your geriatric population, they tend not to have these typical signs and symptoms like the fever and the persistent need to void and maybe even any pain with peeing. And what they tend to experience is all of a sudden they were alert and oriented, but now they're confused. They don't know where they are. They're really agitated and they are falling a lot. I don't know how many times as a nurse I've had patients who were admitted with this. They really didn't know what it was. A doctor suspected a urinary tract infection because all of a sudden they had mental status changes, got really agitated, and turns out had a urinary tract infection, got treated for it, and came back to normal. So really, really watch this in your patients who are elderly, not just for testing purposes, but in the hospital, because you will definitely encounter this. Now let's look at the nursing interventions that you're going to do for a patient with a urinary tract infection. And as I go through this information, be sure to really pay attention to those education pieces, because the NCLEX exam and your nursing lecture exams like to ask questions about how you're going to educate the patient, some things you should watch out for, and things like that. So as the nurse, what we're really doing is that we are going to do the following. We're going to assess that patient for signs and symptoms of a urinary tract infection, because really all patients are at risk for this. If their immune system suppressed, they have diabetes, things like that. So we want to catch this early so they can get treatment fast before it spreads to the kidneys and eventually the systemic circulation. We want to maintain and monitor their fluid status. Look at those I's and O's. Making sure that their urine output is at least 30 cc's an hour, that they're putting out that good amount of urine, because if they're not, chances are they could be going into renal failure. Maybe the UTI has progressed that far. Also, we're going to help them control their pain, because with a UTI, patients will have excruciating pain, especially those spasms and cramping pain. So we'll help them with not only pharmacological medicines, but non-pharmacological techniques as well, which we'll go over here in a second. We'll administer medications per physician's order, like the pain relievers, but also the antibiotics. We're going to really be educating our patients, like how to prevent this from happening again, and how to take treatment, how to take those antibiotics, how to monitor yourself for urinary tract infection, things like that. We're going to be monitoring them for complications. Again, it's when they're becoming septic, maybe treatment's not working. We want to make sure that they're not entering into that. And we're going to collect and monitor their labs, like that urinalysis, that urine culture. And if anything comes back abnormal, like there's white blood cells or bacteria present in that UA, we need to let the physician know so they can order treatment. Now, typically, whenever a patient has a Foley catheter, the physician will order you to remove it if a urinary tract infection is present, but always check with the physician if they want you to remove that, because you'll need an order for that, because again, Foley catheter is a great entrance for bacteria. And some things I've seen is that whenever a patient has a Foley catheter and they've developed a urinary tract infection, they may start complaining of the need to void, even though they have this catheter that's draining the urine. So if it's not kinked somewhere, the tubing's not kinked somewhere, the bladder may be irritating, the urethra may be irritated, they may have an infection. Another thing, remember with the urine culture, you want to collect that first and then start the antibiotics. Always remember that. We'll be encouraging at least 2.5 to 3 liters of fluid per day, as long as they don't have any contraindications, whatever the physician orders. And why? Why do we want them to take in this much fluid? Well, number one, we want the urinary system to be flushing itself, getting that bacteria out. They're on antibiotics, it's fighting it, but we want it out. And we want to keep the urine diluted. A lot of times, an antibiotic that's typically prescribed for a urinary tract infection is a group of drugs called sulfonamides. Bactrim is a popular one. And the thing with Bactrim is that if the urine is concentrated, they can develop what's called crystal urea, where they develop these little crystals in their urine. And this will not happen if the urine is diluted. It decreases the chances. So you want to really tell them to consume a lot of fluid and let the patient know that this can possibly happen. So this is an incentive why you need to consume good amounts of fluid. And some other things that I want to point out about the Bactrim is that with antibiotics, we really want to try to give these at the same time every day. So tell the patient, take this at the same time every day. Why? Because we want to keep that blood level constant so that antibiotic can keep working. We don't want those blood levels to dip of the antibiotic because it won't fight it as fast. Then we want them to always take all the antibiotics. Don't just quit taking them because your urinary tract infection, you think it's gone, because this increases the resistance of the bacteria to the antibiotics. So always take all the antibiotics. Another thing we're going to be doing is encouraging the patient to void every 2 to 3 hours, helping them go every 2 to 3 hours. Keep that system flushed. We don't want to have an overextended bladder, keeping that urine in there. With the pain, non-pharmacological, what we could do is a warm sitz bath, help that urethra is really inflamed, that can help ease that, or a heating pad. Another thing, physicians sometimes ordered a drug called pyridium, also called phenazopiridine, sometimes Urostat. And what this is like analgesic. It will help coat the bladder and the urethra, and it will provide relief, decrease that burning urine, the spasms, things like that. But one thing you have to watch with this, and it's a normal side effect, is the orange colored urine. It's almost the same color as what this marker looks like. It can be a little reddish tint, but this tends to alarm patients whenever they go to void in the commode because it's just this really bright orange. So that is a normal side effect, and if you see that as a nurse, know that it's normal. Okay, some education pieces for your patients in preventing urinary tract infections. Again, they need to take all those antibiotics. Female patients need to wipe from front to back, very crucial. If they wipe from back to front, they'll introduce that bacteria in the rectum to the urethra. After sexual intercourse, it's very important to void, to clear out that urethra. They also need to avoid wearing any tight underwear. It's best to wear loose cotton underwear. Avoid bubble baths, perfume, sprays, powders. This irritates the urethra. And during menstruation, avoid tampons and be sure to change those sanitary pads often. And to avoid caffeine and alcohol, because these products actually irritate the bladder and the urethra. And to void every 2 to 3 hours, again, just to keep that urinary system flushed. Okay, so that wraps up this lecture on UTIs. Thank you so much for watching. Don't forget to take the free quiz and to subscribe to our channel for more videos.